Paracetamol. Paracetamol. Acetaminophen. Indications and dose. Mild to moderate pain pyrexia. By mouth. Adult, 0.5 to 1 gram every 4 to 6 hours, maximum 4 grams per day. By intravenous infusion. Adult, body weight 10 to 50 kg, 15 mg per kilogram every 4 to 6 hours. Dose to be administered over 15 minutes, maximum 60 mg per kilogram per day. Adult, body weight 50 kg and above, 1 gram every 4 to 6 hours. Dose to be administered over 15 minutes, maximum 4 grams per day. By rectum. Adult, 0.5 to 1 gram every 4 to 6 hours. Maximum 4 grams per day. Mild to moderate pain in patients with risk factors for hepatotoxicity. By intravenous infusion. Adult, body weight 50 kg and above, 1 gram every 4 to 6 hours. Dose to be administered over 15 minutes. Maximum 3 grams per day. Pain, pyrexia with discomfort. By mouth. Child 3 to 5 months, 60 mg every 4 to 6 hours, maximum 4 doses per day. Child 6 months year, 120 mg every 4 to 6 hours. Maximum 4 doses per day. Child 2 to 3 years, 180 mg every 4 to 6 hours. Maximum 4 doses per day. Child 4 to 5 years, 240 mg every 4 to 6 hours, maximum 4 doses per day. Child 6 to 7 years, 240 to 250 mg every 4 to 6 hours. Maximum 4 doses per day. Child 8 to 9 years, 360 to 375 mg every 4 to 6 hours. Maximum 4 doses per day. Child 10 to 11 years, 480 to 500 mg every 4 to 6 hours. Maximum 4 doses per day. Child 12 to 15 years, 480 to 750 mg every 4 to 6 hours. Maximum 4 doses per day. Child 16 to 17 years, 0.5-1 g every 4 to 6 hours. Maximum 4 doses per day. By rectum. Child 3 to 11 months, 60 to 125 mg every 4 to 6 hours as required, maximum 4 doses per day. Child 1 to 4 years, 125 to 250 mg every 4 to 6 hours as required, maximum 4 doses per day. Child 5 to 11 years, 250 to 500 mg every 4 to 6 hours as required, maximum 4 doses per day. Child 12 to 17 years, 500 mg every 4 to 6 hours. Post-immunization pyrexia in infants. By mouth. Child 2 months, 60 mg for 1 dose, then 60 mg after 4 to 6 hours if required. Panadol OA. Mild to moderate pain pyrexia. By mouth. Adult, 1 gram up to 4 times a day, dose not to be taken more often than every 4 hours. Unlicensed use paracetamol oral suspension. 500 mg, 5 ml not licensed for use in children under 16 years. Not licensed for use in children under 2 months. By mouth, under 3 months by rectum. Intravenous. Infusion not licensed in preterm neonates, or children. And neonates with body weight under 10 kg. Cautions alcohol dependence before administering. Check when paracetamol last administered and cumulative paracetamol dose over previous 24 hours. Chronic alcoholism, chronic dehydration, chronic malnutrition, hepatocellular insufficiency. Appendix 1 Paracetamol. Overdose. Important, liver damage and less frequently renal damage can occur following overdose. Nausea and vomiting, the only early features of poisoning, usually settle within 24 hours. Persistence. Beyond this time, often associated with the onset of right subcostal pain and tenderness, usually indicates development of hepatic necrosis. For specific details on the management of poisoning, see paracetamol under emergency treatment of poisoning. P. 1123. Pregnancy not known to be harmful. Breastfeeding amount too small to be harmful. Hepatic impairment dose-related toxicity avoid large doses. Renal impairment. In adults increase infusion dose interval to every 6 hours if eGFR less than 30 ml per minute 1.73 square meters. In children increase infusion dose interval to every 6 hours if estimated glomerular filtration rate less than 30 ml per minute 1.73 square meters. Directions for administration for intravenous infusion. Pefalgan, give in glucose 5% or sodium chloride 0.9%. Dilute to a concentration of not less than 1 mg per milliliter and use within an hour, may also be given undiluted. 4. Children under 33 kg, use 50 ml vial. Prescribing and dispensing information BP directs that when pediatric paracetamol oral suspension or pediatric paracetamol mixture is prescribed, paracetamol oral suspension 120 mg, 5 ml should be dispensed. Patient and carer advice. In children, medicines for children leaflet, paracetamol for mild to moderate pain, mild to moderate pain. Profession-specific information. Dental practitioner's formulary. Paracetamol tablets may be prescribed. Paracetamol soluble tablets 500 mg may be prescribed. Paracetamol oral suspension may be prescribed. Exceptions to legal CATEGO paracetamol capsules or tablets can be sold to the public provided packs contain no more than 32 capsules or tablets. Pharmacists can sell multiple packs up to a total quantity of 100 capsules or tablets in justifiable circumstances. Medicinal forms. There can be variation in the licensing of different medicines containing the same drug. Forms available from special order. Manufacturers include suppository, oral suspension, oral solution, tablet. Side effects. General side effects. Rare acute generalized exanthematis pustulosis. Malaise skin reactions, Stevens-Johnson syndrome. Toxic epidermal necrolysis. Frequency not known, blood disorders, leukopenia. Neutropenia, thrombocytopenia. Specific side effects. Rare, with intravenous use, flushing, tachycardia. Frequency not known. With intravenous use, hypotension.
Thank you for watching. Please subscribe us.